Kindly confirm me if you are able to see
Yeah,
the slide.
yeah, ma'am. Yeah, ma'am. I'm hearing.
Okay. So in the last class, we talk about health. We started the topic health education. Okay. Were you in the last class? Any one of you? No? Okay. We can use the chat box in case you have any query, or you want to ask anything, or you have any doubts. Just keep typing on chat box. Okay. So you guys are from which batch? Okay, I'll just start it because we are running out of time now. Okay, so if we talk about the definition of health education, it is basically a process in which we encourage people so that they can be healthy. They know how to stay healthy, and what an individual can do in a collective manner so that they can maintain health, and they can also seek help or utilize health services whenever it is required. So this is as per the Alma-Ata Declaration, uh, which was it is there since 1978. So why health education is so important? So basically, foremost is that health education, it impacts behavior of the individual who are educated by the educators. So these behaviors are adopted. When we talk about certain behaviors through health education, these are adopted, and then the individuals who are at the receiver end, they may modify those behaviors. Okay. And the receivers can be individual, can be there any groups or family. In fact, many health professionals or organization, or sometimes it might be the entire community to whom we are giving the or imparting the health education. Then what happened? Health education is always target based. We need to take care, like what is the target population, and depending on the target, there are certain strategies which needs to be developed. So for example, if we are talking about a elderly population, on the contrary, if we are talking, the target population is you can say is young generation or children, so the strategies will be different in both the cases. And sometimes these are health related also. So for example, communicable diseases, the strategy for a communicable disease will be totally different from a non-communicable disease, where we will be focusing mostly on prevention of risk factors, whereas in case of communicable, there are lot many things about preventing, like to interfere with the transmission. So many things have to be taken care. So a same strategies cannot be applicable to many issues. So strategies are always dependent upon target population, and sometimes these are like disease specific, or like whatever health concern is there. So how it helps the receiver? And as we already like talked, receiver can be any individual or health professional organization. Okay, so health education can help in increase the knowledge, and then as per the knowledge which is received by the receiver, they can modify their behavior or their patterns. Okay, that can be done. So if we talk about, there has been a major shift in health education. Okay, initially, if we talk about Alma-Ata Declaration, which was adopted in 1978, at that time the main emphasis was prevention. Okay, prevention of disease. But now it is modified, because gradually the environment, social factors, determinants, they have changed. So there is a shift. As we all know now, there is a triple burden of diseases. So we talk about more about non-communicable diseases. So now the strategies or concepts have been changing from the earlier one. And also, like lesson learned from the past strategies, it has been understood that no strategy can be implemented without involvement of community, because they are the target audience. And actually, I just reached from office, so I hope you don't mind if I take sip of my tea in between. Okay. So yeah. So now we know, like, any strategy can only be successful if there is a stakeholder engagement. What is stakeholder? There can be many stakeholders, like community is there, then health professionals is there, government is there, then many civil society bodies are there. So many you can say acting agencies are there who act as a stakeholder, and together they can only contribute in educating or getting the like concepts adapted, and then a behavior change can be done. What are the aims and objective of health education? So first and foremost is, it is to encourage people or community so that they can adopt a like health promotion lifestyle and practices. And it is not only like adopting, it is basically sustaining also. So it's not like a matter of a day or two. Basically, whenever people adapt to any, they adopt a lifestyle, it has to be sustained. For example, if we talk about like adopting a healthy lifestyle, so whether they are taking a good, a healthy diet, or they are following certain physical activities, they are taking care of their mental health. So these all these behaviors need to be sustained. Now, the second aim and objective of health education is to promote the proper use of health services available to the community. So it's okay at individual level or community level, people can do a lot of behavior change. But it is not only prevention. Sometimes it is also very important for to utilize the uh, are you able to see the slide now?
Yes, ma'am.
Hmm. So it is also very important so that they can, avail all the health services which are available to that, because it acts as a it acts as a intervention. Now, along with the like utilization of services and gaining of knowledges, have you heard? You all must have heard the term CAP. Okay, knowledge, attitude, and practices. So we impart the knowledge in health education, but we also talk about health promotion. So these two things are part of that when we talk about attitude and practices. So ultimately, behavior change is through knowledge, gaining the knowledge, and then change in attitude, and finally developing certain skills so that people they can practices those skills. Okay, they know how to take rational decision so that they can solve the problems. Now, one more aim or objective for health education is to stimulate individual, okay, and community self-reliance, and their participation. Active participation is very, very important so that they can achieve health development through individual and community involvement. For example, I'm just giving an example, like immunization. So in case there is a like a community where the immunization rates are very low, so for example, the asha worker, they are creating awareness there. Once the community take active participation, only after that the rate can be increased. Okay, rate of getting like services can be improved. Okay, so it is the involvement of community. Okay, how healthcare providers play a very, very crucial role while like imparting health education. So first and foremost is they provide opportunity for people to learn how to identify and analyze health related problems to set their own targets and priorities. So this is need based. Okay, nowadays, as I told you, the uh, health education uh, health education concept has changed. So now it is need based, felt need based. This is the term which we use, felt need based, of whom, on the community. So one problem might not be the problem in certain other community. Okay, so before imparting any health education, it is very important that we should be aware about what actually people of that community they actually require, whether this particular intervention is required or not. And sometimes they might come up with certain other things. So according to that, strategies need to be developed. Then make health and health related information easily accessible to the community. This is very important point. Why? Because in our health, in our ministry or in our health system, lot of information is developed nowadays. Many civil society organizations, they themselves are developing a lot of information, but somehow it dilutes from the central government when it goes to state government, and when it goes to rural or urban PHCs, the information is just diluted. Okay, so the healthcare providers, they can play a very, very important role, because they act as a bridge. They act as a bridge, and they provide the first-hand information to the community. So that is why nowadays we talk about like they can use various modes. They are the first line of contact. Even if you talk about a primary healthcare center in a village, so the staff there, if they are well equipped with the knowledge, okay, about any topic, for example, nowadays there are automatic partograph. I hope everyone understand. So to measure the fetal rate. Okay. So nowadays these are available, but sometimes what happen, they are not conveyed to the community. So this is very important, how people can, how the health providers can interact with the families and the patient, and they can tell them about the services which are available and accessible. Okay, simple example we can take, like 108 ambulance is available. So, but how this information is, how we are going to pass on the information to the people who are utilizing the services. That is very important, and this can only be done through the staff, healthcare professional staff, which are working at ground. So they can be MOs, nurses, LHVs, and then people who are working in field, even pharmacists. So they play a very, very critical role in imparting this knowledge or information to the community. Next is indicate to the people alternative solution for solving the identify health and health related problems. So healthcare providers can play a major role in providing alternative solutions. Okay, then we always talk about like prevention, and after the COVID we all know like prevention is how important it is. So when we talk about preventive measures, healthcare providers, they play a very important role in that, because they are the ones who transfer the knowledge for this, or you can say preventive measures are this knowledge is transferred to the people through the healthcare providers. Now, if we talk about health education, there are 4 approaches. Okay, I will be talking about certain things, approaches, models, and methods. Okay, next 3 days I will be taking your class, and most probably I'll finish this whole paper of yours. Okay, so today I'll talk about approaches. So as you can see, there are 4 well-known approaches of health education. First is regulatory, second is service, third is health education approach, and last one, this last one is a recent addition. Earlier, there were only 3 approaches. So we'll like talk about them one by one. First is regulatory approach. So as the name suggests, as the name itself suggests, some regulations are there in regulatory approach. Okay, so who regulates these you can say behaviors? So basically it is government. Okay, through some direct or indirect interventions. Basically, this health education is governed by or regulated by the government, so that the human behavior can be altered. They talk about this. So I have like taken 2 examples. For example, the child marriage restraint in India. Okay, this was a behavior, this was a culture in the country. But then what happened? There was a regulatory approach. A direct intervention from the government body was there. Okay, just a second. Just a second. Let me just give me a second. I'm just putting my chart. Just a second. Okay. Yeah, it's better. Yeah. So, yeah, we were talking about the example where child marriage. Okay. So child marriage restraint order came, a bill was passed, and this is how a compulsion regulatory bill was there, that now no more child marriages will be into existence. So there we can see there was a direct regulatory approach. Then very simple example is compulsory wearing of seat belt and helmet. So we all know that there are, like in India, the road traffic injuries, mortality due to road traffic injuries is at 3rd position. Okay, so how we can there were like some preventive measures for that, which came under regulatory approach. How? So there was a compulsory wearing of seat belt and helmet, and it has definitely reduced the number of cases. Okay, number of cases for like morbidity and mortality has been reduced by this simple regulatory approach. Then when very important or surprising example, which was in 1976, Congress government, they enforced sterilization campaign, and they saw a defeat in the 1976-77 elections due to this, because this was a regulatory approach, but it was not welcomed by the community. So sometimes regulatory approach, they might have a, say optimistic effect, and sometimes even a pessimistic effect. Even as you can see from this sterilization campaign example, that it was, I mean, they got defeated. The whole government was changed. Okay, so a regulatory approach, sometimes they will play a very positive as well as a positive impact. They have mostly positive impact. Now, next is service approach. So this was started in 1960 as basic health services. Okay, it is basically it is about providing all the health services to people at their, at their what do you call, at their doorstep. This was basically that everyone should get all the facilities. But this approach was also, lesson learned was it was a failure. Why? Because a certain checklist of services was made and it was implemented. Okay, it was like universal service provision was there, but because it was not felt need based, so that is why this was a failure. Because the community, they were not looking for all the all the services. So the services should be, as I already said, they should be felt need based. They should be customized. You can say, now everyone knows this term customized. So there should be a customized package for every community, every target audience. Only then it can be a success. For example, water seal latrines, okay, toilets, they were provided by government free of cost. Okay, so that they can minimize open defecation. But what happened? Many people in rural areas, they did not make use of it. So it was just a wastage. Okay, so they were not properly educated, and then behavior change takes like time also. So sometimes these services approaches, they were not welcomed. Next is health education approach. Okay, so it was basically, we were educating, we were like, we were just imparting the knowledge to the people. This was based on that. So, and main objective was that people must be, educated, and they should be well informed, like what they should do, and then they should be encouraged to make a healthy choice. So for example, like smoking, use of safe water supply, fertility control, they were just imparted knowledge about these things. And then in health education, we just impart the knowledge. It is not forceful implementation. Okay, it's nobody force anyone. It is ultimately, it is the decision of the receivers, whether they are going to adopt to that lifestyle or that thing, preventive measure or whatever we are, sharing health knowledge, we are sharing in health education. It is totally their final decision lies with the receiver. And then it was like health education should be started among children and young population, because if we if we train people or we impart knowledge people and they adopt healthy lifestyle at very young age, so they will of course follow it throughout their lives. And then the lifespan also, it impacts the community. They will then again share the knowledge with more people in the community. Now, the most important approach is primary healthcare approach. As you can see, this is a new approach. Okay, this started from the people with their full participation and active involvement in the planning and delivery of health services. Okay, so main example is like community involvement and intersectoral coordination. If we talk about any example, so like open defecation, as we talked about open defecation. So these government might be providing some toilets, but the local government, they can come up with certain concepts, how they have the solution. Okay, they can find out certain solution. For example, the toilets, they need not to be installed in the houses only. They can be installed little bit far away from the houses. But then there can be like common defecation centers can be there. So in that, the community, they played a very, very important role, because they came up with the idea with the village panchayat and all that. So now community involvement, with the community involvement and active participation, yes, there can be a change which can be bring about. We can bring a change. Now we'll talk about health education and what is a propaganda or publicity. These are two things. Okay, sometimes people use them synonymously. So when we talk about health education, in health education, knowledge and skills are actively acquired. Whereas if we talk about propaganda, or we are publicizing something, then knowledge is instilled in the minds of people. Okay. Now, next is, I don't know why I wrote BF. I just forgot I might have some example in my. Okay. If I remember, I'll tell you. Okay. Then in health education, it makes people think for themselves. So it is, it is encouragement. in health education, we encourage people to think about themselves, to understand their needs. Whereas in propaganda or publicity, it prevents or discourages thinking, because there are certain ready-made slogans are already available in the market. Okay, if we talk about health education, disciplines, primitive desires are there, whereas in propaganda or publicity, it stimulates primitive desires. Okay, health education helps to develop reflective behavior. It trains people, but it never forces people to use any judgment before acting. Whereas in case of propaganda or publicity, it is a reflexive behavior. It basically instigates certain impulsive actions. Then a very important difference you can see is health education, it appeals to reason, whereas publicity or propaganda, it appeals to emotions. Next is, health education develops individually, personality, and self expressions. Whereas if we talk about publicity, there is a standard pattern of attitudes. Okay, according to the molds. For example, TV, they have certain fixed patterns. Okay, programs are there which have certain fixed patterns, certain fixed slogans. People are influenced by them. Then in health education, knowledge is acquired how? Through self-reliant activity. Whereas in propaganda, knowledge is imparted, but it is spoon-fed and it is passively received. In health education, the process is centered, aimed at developing favorable attitudes, habits, and skills. Whereas in propaganda and publicity, the process is informed, centered. No change in attitude or behavior is designed. Now, we talk about what are general contents of health education. So mostly when we talk about health education, we talk about human biology, okay, nutrition, hygiene, then family health or community health, and disease prevention and control is very important. Mostly health education topics or health concerns, when we talk about them, it is about how we can prevent or how we can control the disease. Then, and very upcoming topic is mental health. Now everyone talks about that, and even the definition by WHO for disease is, in that also mental health is included. We know, like, only not by not only, I mean, nutrition and physical health cannot only lead to, a person cannot only lead a healthy life by following these things. Mental health is also very important. So nowadays everyone talks about mental health. We also have a national mental health program. See, then prevention of accidents, use of health services. So these I have mentioned few topics in which when we, I mean, they comprise the content of health education. Okay, now when we talk about health education, there are certain principles which needs to be followed. Okay, first and foremost is credibility. What is credibility? It is the degree to which the message to be communicated is perceived as trustworthy by the receiver. In simple language, we can say the trust. Basically, credibility is how much the receiver trust to the information. Okay, up to what degree a receiver, he trusts the information he is receiving. Why? Because until unless people have trust and confidence in the communicator, no desired action will be ensured. Once people they don't trust the communicator, they are not desiring to receive the information. Okay, they will just neglect or half-heartedly take the information. So credibility is very, very important. Like, for example, few of the news channels, people, I mean, they have more viewer. Why? Because they have a credibility. Okay, when any information comes from government agencies, okay, people take it people receive it in a proper way. Why? Because everyone have faith in government agencies. If government is, for example, publishing any information, so they trust it. Then second is interest. The message should be to the interest of the receiver. Until unless the receiver, they know, they want to take the information, it is, until unless it is like of use to them, they will not be adapting any of the information, or taking and receiving any of the information. In this, since I have started the class, I am regularly, you can say, pressurizing on participation or felt need based. Why? Because participation is very important. Whenever we talk about health education, it cannot be fulfilled if we don't have the participation from the receiver, and here in this case is the community. Okay, as the Alma Ata Declaration states, the people have a right and duty to participate individually or collectively in the planning and implementation of the health services. Why? Because health services, designing of health services and strategies for implementation, they can only be done successfully, they can only be implemented successfully once there is a active participation from the community. Motivation. In every person, there is a fundamental desire, okay, to learn, and hence awakening this desire is called motivation. In health education, we can use motivation to change the behavior. This line is very, very important. Motivation plays a very important role, because health education, we are just, imparting the knowledge. I told you the term CAP, knowledge, attitude, and practice. But when we talk knowledge, it's easy. The health professional or any sender, they can impart the knowledge. But when we talk about attitude and practices, where we help to develop the skills, then it is very important that at the receiver end, there should be a motivation. Otherwise, there is no behavior change can be observed until unless there is a motivation. Next is comprehension. It means that we should understand, we should, make a judgment about understanding level of the receiver. Okay. Same thing. I mean, we are talking about the same thing, that it is the target population. Understanding of target population is very, very important. A same education material cannot be shared with a population of a rural population or a urban population. If there is a, I mean, there are various segregations in the society, socio-demographic profile. So these all matters. Okay, so a comprehension is very important. Hmm? Like I have given this example. For example, doctor asks a diabetic person, you need to cut down the foods. So, and this person who is diabetic, for example, he even doesn't know like what are starchy food. Then the information which was passed on was business, how people can make use of that. Okay. So we then, for example, if a material, health education material is developed in English or Hindi, so and it is circulated in regional areas also. So unless it is developed in regional languages, it is of no use to the people. They won't be able to understand the information. Then reinforcement. Okay. Why it is important? Because whenever reinforcement is repetitively enforcing the things so that people can remember it. Okay, no one can learn until unless someone is like superhuman. Otherwise, we all need to do things in a repetitive manner. We need to like go through the things again and again so that we can understand the things. So reinforcement is very important. Then next is learning by doing. So learning is an action, okay, process, not a memorizing one. There is this Chinese proverb which I have included. If I hear, I forget. If I see, I remember. If I do, I know. Okay, so learning is very important. We can take the example on hand washing. So people can see, many times they can see hand washing steps on television or in posters, pamphlets. Okay, even some people like, for example, in the hospitals, many people can demonstrate them. But until unless the person they themselves do it, hmm, they are not able to get skill of hand washing. Although it is a very simple thing, but all the steps need to be followed. It can only be done by doing. I have observed many people, they like the use of gloves. Okay, use of glove everyone knows, but while we are removing them, there is a simple way to remove so that we can minimize the infection. So these certain skills which are very simple but very very important when we talk about like prevention or protection. So these can only be learned by doing. Then known to unknown. Okay, it means from concrete to abstract, from particular to general, simple to more more difficult. So people should understand, like we only talk about something concrete, but sometimes the whole genre can be, it need to be taken care. Setting an example. So foremost is the health educator should set a good example in the things he is teaching. So for example, if a person is telling, a health educator is there, he is communicating that people should wear mask. Okay, they should follow cuff etiquettes, but he himself is not following those things, then there is no point. Okay, people will not be influenced, as the first point was faith, trust. So they won't be trusting, they will having trust issues. Okay, and they won't be following. So setting the example is very important. Next is good human relations. So when there are trust can be built up through good relationships. Okay, so if the paramedical staff or the health professional staff, they have a very good good relationship with the community people, so the information can be easily passed on. Okay, next is feedback. So the health, as we have already like talked about it, there was a frame for communication where there was a sender, there was a receiver, and there was a feedback mechanism. We already discussed this in detail, why a feedback mechanism is important, to understand that whatever information was passed on from the sender has been well captured by the receiver. Okay, so feedback we have already discussed in detail. Leaders. So in health education, local leaders play a very important role. Why? Because people listen to them. They are like respectable figures. Okay, influencers. People get influenced. So for first and foremost, if a leader is convinced for any health education or any information, then it can be well taken by rest of the community. For example, here we will take example of religious leaders. So whenever we want to get into a community, there are religious leaders. Okay, if we convince them, so community people, they like wholeheartedly accept any new intervention. Okay, when we practice of health education, there are certain aids which are used. Okay, so what are these? No health education can be effective without audiovisual aids. Why? Because sometimes what happens, written material, it has an impact, but as we have discussed, like in written material, there are certain constraints. For example, the community people, they might be literate, they might be illiterate. If they are literate, their level of literacy can vary. Because if even we talk about like Hindi, so the Hindi also have thousands of version in total, like in our country. Okay, so there is a huge variation because of the like diversity in the geography of the country. Then in the regional language, it is not possible to every time, to translate everything in regional language. So sometimes these videos, they are very helpful. Okay, language can be mentioned there, but of course by visible patterns, people are more they can be like, these are easy to understand. Okay, then in auditory aids, we have radio, tape recorders, microphone, amplifiers, and earphones. When we talk about visual aids, these can be leaflet, posters, charts, slides, films. Okay, and the most effective ways when we combine audio, video. Okay, TV, sound films, and slide tapes combinations. These are very, very helpful. Okay, when we impart any information or there is a discussion in the community, you can see there is a sociogram. So it should be a good network. Okay, everyone should have an opportunity to talk to everyone, every person or every target member in the as you can see in the diagram also, every point person, they have a right to talk to among themselves also, and then to the sender also. Whereas in the first figure, you can see there is a two-way communication between the target points and the sender, but among the target points there is no there is a this like a two-way communication is lagging, so people don't know what is going on. So there is a no, there is a improper flow of information. So if there are no questions, you can type if you have any questions, otherwise I'll go to the next slides. Any questions till now? Okay, so I'll start with the methods and models then. Okay.
Yeah.
So you just give me 1 second. Okay. So when we talk, okay, so I told you I will talk about approaches we have covered. Now I'll be talking about method and model. Okay, what are methods and models in health education? So when we talk about method, what is a method? So as you can see from the definition, method is a procedure, technique, or a way of doing something, which is especially always in accordance with a definite plan. Method, it is always operational. Okay. When we talk about model, what is a model? It is a standard or example for imitation. A model is always a fixed thing, and it can be imitated or comparison can be done. It is abstract, theory, and conceptual. Okay, so I hope as this definition is self-explanatory and very simple, I hope you people understand what is the difference between a method and a model. Okay. Okay. Now, methods of health education. Why it is very important in health education? So why? Because these are certain techniques, or you can say certain ways. What happens in these techniques? These techniques have a series of activities which are carried out for what? To communicate ideas, information, and develop necessary skills and attitude. Okay. So always remember this thing, CAP. Just always remember CAP. Any definition, whatever comes, you have to somehow weave these three words: knowledge, attitude, and practice.
Practice.
Okay, yeah. Always remember, somehow in any question now, this is the like these three terms you need to, what you can say, घुसा ही देना उसको तो कहीं ना कहीं पे, ठीक है. तो अगर इस डेफिनेशन में भी देखोगे ना, सिंपल यही है. वाई? सीरीज ऑफ एक्टिविटी हम करते ही हैं. कैप के लिए क्या करते हैं? वी डू अ लॉट ऑफ एक्टिविटीज. एक्टिविटीज में क्या करोगे? बेसिकली नॉलेज की बात हो गई. कैप ही याद रखना. नॉलेज कैसे करोगे? कम्युनिकेट करेंगे आइडियाज. देन आइडियाज कम्युनिकेट कर में क्या दोगे? इंफॉर्मेशन ही करोगे. और उसके लिए क्या करना है? यू डेवलप एटीट्यूड. चेंज करने के लिए क्या करोगे? यू विल गिव डेवलप सर्टेन skills, imparting of skills करोगे, so that people can practice the developed skill. Okay, so these are, that is why methods of health education are very important. अब क्या है? जस्ट रिमेम्बर दिस चार्ट. ओके, जैसे भी हो ये लर्न कर लेना. दिस इज वेरी इंपॉर्टेंट. ये वाला क्वेश्चन तो आता ही है. ओके, सो देर आर 3 अप्रोचेस आर देयर. अभी हमने बात की थी हेल्थ एजुकेशन की. ओके, उसमें हमारे चार चार अप्रोच थे. अभी हमारा मेथड्स है. ओके, अप्रोच 4 थे और मेथड्स में 3 है अप्रोच. इसको जस्ट मतलब मेक नोट्स फॉर देम. ठीक है, इसमें क्या है? दिस इज वेरी सिंपल. पता है, दीज थिंग्स आर वेरी सिंपल, बट यू नीड टू लाइक जॉट इट डाउन इट प्रॉपरली. जस्ट रिमेम्बर द मेन हेडिंग्स एंड अंदर तो सब कुछ लिख ही सकते हैं. तो फर्स्ट वन इज individual approach, second is a group approach, and third one is a mass approach. So then there are certain method in approach. There are certain ways how these can be how this can be done. So for if we talk about like individual, there are personal contact, home visits are there, personal letters are there. Okay, these are very simple and basic. Then in group approach, we have 2 ways. First is lecture, where one lecturer is there and he impart the knowledge. Second is demonstration. Now, for demonstration, there are multiple ways which can be used. Okay, so for example, group demonstration can be there. Then there can be certain panels, symposiums can be there, conferences can be there, seminars, and mid-media. We talked about mid-media. What comes in that? Role plays, folk plays. Okay, so they have this. These are certain ways of group approach. Okay, next is a mass approach. Mass approach is where we can use certain medium so that majority of people, they can be influenced. Okay, and what can be the ways? Television can be used, radio can be used, then newspaper, printing, direct mailing to multiple people, posters, exhibitions, folk method, and internet. Okay, so this table is very useful. Kindly learn it by heart. Now we'll discuss about them. So we talked about like informal and formal methods. So these approaches can be fitted into informal and formal methods. So informal, we know that there is no specific dialogue. These are not systematic. We discussed the difference between formal and informal in great detail in last class. So today I'll just just talk about only the main points. So informal methods, health talks can be done, lectures can be given, brainstorming sessions, group discussions can be part of informal method. Then group discussion, demonstration. Okay, then role plays. Okay, these are informal methods. Drama, case studies, traditional media can be part of informal. But when there are formal methods, we all know that when we talk about formal, we have these are systematic, there is an origin, there is a schedule. Okay, so these are like very systematic, and they have fixed information. Okay, so in this, the like methods will be conferences, workshops, seminars, panel discussions, and symposium can be part of informal methods. Okay, when now we talk about individual method, what happens? So, for example, if I have taken examples to health center. Okay, so the health professional, they gets an opportunity for what? To educate that person about about the disease, what are the causes, how prevention can be taken, and along with that few other things can also be approach can be used by public health people. Okay, whenever public health person, whenever this patient is visiting the health facility, how this is helpful when this person whom we have educated goes back to the family or in the community, it is, you can say, it is a kind of TOT. TOT, although, is a very strong person. Okay, so that there can be a change in his behavior and attitude. And once he goes back to the community or he goes back to the family, of course, he will share that knowledge. So in individual methods, just a second. दीदी 10 मिनट में करती हूँ, क्लास ले रही हूँ. Okay, so yeah, so these opportunities should be availed as much as possible by the healthcare professionals. Now, what are the advantages and disadvantages? Advantages are, it can be done in a doctor's consultation, or simply, for example, a nurse or a pharmacist, they are talking to the person. So you don't need some what do you call, some logistics or some tamjham where you need some separate room. It can be a simple process. You only need it is just a simple simple process where doctor or any health staff, they can just deliver whatever knowledge they want to deliver to the patient. Okay, and uh, I mean, because, and then the patient is like familiar with the healthcare professional, so he have that credibility thing also. That criteria is also there. He will be listening to the healthcare professionals, and then what happened, because it is a one-to-one kind of thing. Okay, interpersonal communication, IPC we say. So because it is an interpersonal communication, so there is also a opportunity for then and their feedback. Or if the patient has certain doubts in his mind, he can just ask them and they can be sorted out at the same place. So these are few advantages. Now, if we talk about like what are the disadvantages, so because only you can reach out to very few people, only a small number of people can be benefited, because the healthcare professional are also overburdened. They have like multiple work to do at the hospital. So how much time they are going to find out to do this interpersonal communication is a major question mark. Okay, and then the thing is like, it is only given to people who come in contact with the doctor. So for example, if a like family visit a hospital, but 4 of the attendants, they are sitting out. Okay, so the doctor will only be able to interact with the patient. So this is the advantage, that you cannot reach to many people. Okay. Okay. Yeah. So I have like put them in tabular form also. Pros and cons of individual method. So if we talk about pros, of course, individual is, as I talked about it, it is credible, because the people who are coming to the doctor, the patients or the family members, they have a faith in the doctor, because whatever information he will be providing, they will be accepting it. Okay. The second is, it permits two-way discussion. So as the patient has a liberty to clear all the doubts, because both of them are sitting. Okay. Then there will be it can be motivational, influential, and supportive. We have discussed these three attributes just now. So because it is motivating. So there are chances that the patient will be adopting the like whatever knowledge they are like imparting. There are chances he will adopt. It is very effective for teaching care and helping. For example, I will take example of breastfeeding. Okay, so the mothers, new mothers, they like face lot of challenges while initial days of breastfeeding. So in that, individual method is very it's very helpful. Individual method is very helpful at those times. Now we talk about like cons. So consequences are, it is expensive. Expensive not only in term of expensive can be because of time also. Okay, expensive because it is time consuming, expensive also because one-on-one person is involved, and then there are limited audience are there. Okay, shall we resume rest in next class?
Yes, ma'am. Yes, ma'am.
Yeah, tomorrow 8 I will be again there. Okay.
Okay, ma'am. Okay.
Yeah. Okay, good night everyone.
Good night, ma'am.
Good night.